One of the most common things that happens in end-stage liver disease or cirrhosis is something called ascites. Ascites looks like basically someone has a really big swollen belly. The belly can get really, really big. Basically what happens is the sac basically that holds all of the organs in the abdomen, that fills up with ascites fluid, or just think of it as fluid. It fills up with fluid, and so it causes the belly to get really, really big and swollen. And it can lead to other sort of complications or other issues. One of those things being that it can cause that person to become very short of breath. If you think about it, a really big belly pushes up on the diaphragm, and so it doesn't allow the lungs to expand as much as they would. It can also lead to something called a pleural effusion, where basically fluid from that abdominal space, that abdominal cavity, basically sneaks up into the area of the lung that surrounds the lung. So that can also cause some shortness of breath. The fluid inside that belly that's filling up, that ascites fluid, can also become infected. If the person with end-stage liver disease or cirrhosis is on hospice, the goal would be really to try to keep that person as comfortable as possible. So typically, hospice will try to recommend things like limiting fluid intake, limiting sodium intake, and sometimes that person with ascites will actually have a tube placed in the abdomen to help relieve some of that fluid and remove some of that fluid from the abdomen to help decrease that big swollen belly.